last year diagnosed a teenager with acne. We were denied coverage for a pre-existing condition. And it was cystic acne, which is the scarring, would probably leave him scarred for life. Totally denied. Every month it cost us almost $500. We pay a premium every month. And how can that be? That you pay a premium, you're denied, and how can acne be a pre-existing condition?
That question to myself if I were in your position. I don't know that, I don't know that you'd get a response, what the response would be, but again, I think whatever the pre-existing condition may be, for whatever pre-existing condition you get denied coverage, again, the point of this is to make sure that that never happens again.
Larry Bowden.
I worked for a credit union for 28 years. One could argue that the CEO's salary might have been high. However, I believe truly if credit unions could serve as a model for insurance companies, abandon the obscene multi-million-dollar salaries of CEOs, pay the administrators a reasonable, maybe even a little more than reasonable salary, I think credit unions could serve as a great model for the responsible fiscal operation of insurance companies.
I'm from here in Iowa City. I have a small business. I have 5 full-time employees. 4 years ago, my company health insurance premium was high. Over the last 4 years, it's increased 60%. I can't afford any further increases, anything close to that, and I'm wondering, what am I to do?
Great question, Paul. Small business, this is something, again, where the question is, what can small businesses do? Keep in mind that under this legislation, it is in fact the case that every individual will have to have health insurance, and every business will have to provide health insurance, okay? Keep that in mind, all right? Straight up, so you know that. And if they don't, there'll be penalties for you as an individual and for businesses as well. However, the initial legislation, again, which I voted for, but I believe that we should do more, and we did more. I didn't, but the Energy and Commerce Committee did more. If you have, in the initial legislation, if you have a payroll of $250,000 or less, you're exempt from providing health coverage for that certain percentage of the cost for your employees. Your employees still have to get the health coverage, but you don't have to pay for it if you're a small business and your payroll is $250,000 or less. There was an amendment in the Energy and Commerce Committee, again, right before I came back for the August recess, and I agreed with this, actually, and this was part of the Blue Dogs, the more conservative Democratic group. They would identify themselves that way. They got that deal through with Energy and Commerce. Well, that is now $500,000 of payroll. Now, there are a lot of small businesses that have a payroll way beyond $500,000, okay? And they're still going to have to pay for their health insurance, their portion of health insurance for their employees. And the employee will have to pay for some of that as well. But up to $500,000 of payroll, I don't know, Paul, what your payroll is. I'm not going to ask you because that's your business. But if you have a payroll of less than $500,000, you don't have to kick in for this. That, it's estimated by the Blue Dogs, will cover 89% of small businesses in America. To me, this is a heck of a good deal for small business. I will tell you, by the way, you mentioned single payer earlier. William, I guess it was. I had a meeting with small business folks maybe 5 or 6 weeks ago in Cedar Rapids. I was absolutely amazed and shocked when every single one of those small business owners told me that he or she wanted a single-payer system in America. That's not my point. My point is that small business owners have a heck of a time competing with the large businesses. They want to get great talent, just like the large businesses do, okay? But because they cannot afford health care, to provide health care for their workers, then they're playing on an unlevel playing field with the larger companies in any given community. So for them, it's like, we don't care how it gets provided, just provide it so we don't lose out to those larger companies. Now there are some other if you have up to 25 employees and certain payroll, all the rest, you can, once you enter the exchange, that first or second year of operation, and we'll talk about the exchange when we get to that, but small businesses can be aided up to 50% of the cost that they incur for health insurance as well. And anybody here who has further questions about some of the details, about some of the things that I'm talking about, we have lots of staff here. Make sure that you stay in touch with the staff. And we'll provide you specific answers to specific questions if I either don't have the time or I don't have them in my head, all the particular provisions and what they call for. We'll get back to you on that, just so you know.
Okay, we have a question. I have a question. I am college educated, middle class. I'm pregnant. I had a baby 2 years ago. My husband has asthma and allergies. We've forked out 10 grand in healthcare expenses. My salary has stagnated. When am I going to see some relief? Because Social Security takes care of the baby boomers. That war that we went to takes care of the wealthy, like Cheney's cronies. When am I going to have some relief in this country?
That's a great question, Joe. And if you have, insurance now, as I mentioned, or even if you don't, and then you buy insurance under this plan, there will be caps. Now, you've already reached the cap, obviously, at $10,000 as far as the family is concerned. If you had to spend any more than that, you wouldn't have to pay any of that under this plan. Okay, now $10,000 is a lot of money. I understand that. All right. Also, what the goal of this, in no small measure, is cost containment, so that in the future, right? Especially, I think, by providing a public option. Private insurance companies now dominate the market, okay? And where, if you're on your employer's plan, and this really builds upon that system that we have, whether you want a single-payer system, whether you want something that's totally different, this builds on what we have now, just so you know, okay? The idea would be, of course, too, to provide more choices, because if you, I don't know, I haven't done a survey of audiences, but if you're on an employer plan right now, employer-provided plan, my guess is that you rarely have more than a few choices when you're on that plan. I want to provide more choices. A public option, I think, is one way to do that. Now, if I could take just a second to explain kind of what this exchange thing is. You've heard a lot about that, right? Okay. When I got elected, and I had no idea what my benefits were going to be or anything when I was running. I just, was running hard, wanted to get elected to Congress, all the rest. When I got elected, then I had all this information sent to me by the federal government. When Kirsten first got, when we first hired her, she got the same thing. Anyone who's a federal employee gets the same thing. It's now, in effect, an exchange for health care that I entered into when I first was elected and sworn in. I had a choice of about, I don't know how many, 12 or 14 different plans, something like that. I'm not sure the exact number. Right now, Terry and I, we're on a family plan. We have good coverage. It's about $350, $360 a month in premiums. It's a good deal. I want everybody here to have at least as good a deal.